Hey guys, welcome to our presentation. Today we'll be covering anthrax and all of its signs and symptoms and everything you need to know about the disease. So anthrax is caused by Bacillus anthracis. It is a large gram-positive spore-forming rod, and it is also usually surrounded by a capsule, and it produces toxins, which is another reason it makes it really hard to kill off. It belongs to the genus Bacillus, obviously as you can tell by the name, but this is the only obligate pathogen within this genome. And it is also a prokaryote. It is not an exception to the rule, whereas most bacteria are prokaryotes. The disease is acquired in a couple of different ways. There are three routes of infection. You have cutaneous, gastrointestinal, as well as inhalation. So for cutaneous, it enters the body by coming in contact with a scrape or a cut you might have on your outside exposed skin. Now, in order to be contaminated gastrointestinally, you would eat or drink food that is contaminated by water, or also, but for inhalation, you may breathe in spores that may be still lying around in the air. Now, anthrax is found naturally in soil, meaning it commonly affects domestic and wild animals as well, because they eat the soil that may possibly be infected. However, in the US, the infection is rare because the animals are routinely given a vaccination against anthrax. Actually, anthrax is not contagious, so you can't catch it like a cold or a flu. You may only acquire the disease through the three routes that were previously stated. As I just introduced, anthrax is acquired in a couple of different routes. So thus, the signs and symptoms of the anthrax disease will depend on the type of infection that you've acquired. Now, these signs and symptoms can show up at different times. They can show up the next day or even as up to 2 weeks later, again, depending on the route of infection. Now, a cutaneous infection will present as a raised, itchy red bump that can become painless with a black center. As you can see in the picture, it doesn't have a black center yet. However, this would be the beginning stages. Inhalation, you would have flu-like symptoms, which would include fever, sore throat, fatigue. You would have shortness of breath and muscle pain. Injection, which is another route, if you use needles that have been contaminated by someone else's blood, you would see redness and swelling at the area of injection, and like a cutaneous infection, you would see raised itchy red bumps that can become patches of blisters. And later on, these may actually you may actually go into shock in later stages due to this route of infection. And lastly, gastrointestinal will present with different signs such as nausea and vomiting, abdominal pain, fever, a swollen neck, and severe bloody diarrhea that may occur in later stages. So anthrax, as we have previously stated, is not super common here in the US. So generally the doctors will begin a diagnosis by eliminating the possibility of more common diseases. This would include testing for influenza with a rapid influenza test, or they'll even start testing for pneumonia. Now, if these diagnoses are negative, they will move on and start testing for anthrax. And the diagnosis, how you determine it, will also depend on which way the disease was contracted. So for example, if you acquired it through cutaneous, like a scratch on your skin, they may do a skin test, so they'll take a swab and sample the lesion in their test to see if the anthrax bacteria is present. And for gastrointestinal, they may take a stool sample and use that sample and test it in the lab for the bacteria as well. Now, inhalation, they may do a chest x-ray or a CT scan, so this would just show like darker clouded areas over the x-ray if you possibly have it present. Now, you would also probably want to do a testing of the respiratory secretions, so that way they can test for the bacteria within the secretions to see if the cloudiness in the x-ray is what is actually caused by the anthrax bacteria. And then you can also lastly do a blood test and if it's present, the anthrax bacteria will be shown within the lab. And with all of these, they will send it to the lab specifically testing for the anthrax bacteria. So anthrax is a pretty serious disease. It is a rare but serious bacterial illness. Without treatment, this disease can lead to death or other permanent problems. Now, depending on the way in which it was contracted, different areas have a different increased risk of death. For example, in certain areas such as the respiratory and gastrointestinal tract, your chance of death increases even if you catch it early and are treating it just like you would if you had caught it, acquired it through a cutaneous or through an injection. As I talked about earlier, without treatment, anthrax can lead to permanent problems as well as death. So it's important that once it is fully diagnosed, that treatment is begun. But it's important that treatment specifically for anthrax is not started until it is fully diagnosed. So treatment for anthrax, one, they will use antibiotics. These antibiotics will stop the growth and help kill off the bacteria. They are used they're recommended to be taken for 2 months for up to 2 months. Some common types of antibiotics that are used to treat anthrax are ciprofloxacin, levofloxacin, doxycycline, and penicillin. Now, monoclonal antibodies, a new drug that has been developed, also known as raxibacumab, is actually used as an emergency treatment of inhaled anthrax. So what happens is these monoclonal antibodies neutralize the toxins produced by B. anthracis, so anthrax bacterium. This is infused through an IV, and you can actually have reactions to this, so it's important for healthcare providers to watch for reactions such as a rash, a pain in the arm and legs, itchiness, as well as drowsiness. Lastly, obeltoxaximab is a treatment that is approved to treat inhaled anthrax in conjunction with antibacterial drugs. Now again, this drug does come with side effects, so it's important that healthcare workers look for anaphylaxis and so allergic reactions to the drug. And this may appear as a rash, cough, pruritus, dizziness, throat irritation, dyspnea, or chest discomfort. And lastly, we just have a unique fact for you guys relating to anthrax. The Arctic permafrost actually has 1.5 million anthrax-infected reindeer carcasses within it. These spores in the permafrost have survived for over 105 years. And what's really interesting is that as global warming is increasing, the temperatures are rising, so the anthrax is beginning to be released. And this has actually caused an outbreak of anthrax in Russia during a heat wave because with the increased temperatures, anthrax is released into the air, and it obviously has become a problem because it has already caused an outbreak. All right, thank you guys for watching.